Let's be honest. This is a question many men have, but very few feel comfortable asking out loud. What is a normal penis size? And how do you even measure it correctly?
If you've ever quietly worried or compared yourself, especially as you've aged, you're not alone. I'm a urologist, and today I want to gently clear up the confusion with facts, not myths. Whether you're in your 60s, 70s, or beyond, understanding your body is not just okay, it's empowering. Let's begin by clearing up one of the most common concerns men have. What exactly is the average penis size? This question is especially important for older men who may be quietly comparing themselves to unrealistic standards set by media or misinformation. As a urologist, I want you to hear the facts, not the myths. According to multiple medical studies, the average erect penis length is about 1 to 5 inches 13 to 14 cm. The average girth, which is the thickness or circumference, is around 5 to 9 inches 5 to 5 cm when erect. When flaccid, not erect, the average length is usually between 6 to 8 inches. These numbers are based on measurements taken in medical settings, not self-reported guesses, which often tend to be inflated. It's important to know that there's a wide range of what's considered normal. In fact, most men fall within a fairly predictable range. Only a very small percentage have lengths significantly above or below average. Now here's where it gets even more reassuring. Studies show that size does not correlate with age, race, or foot size. Despite common beliefs, your penis may look smaller with age due to changes in skin elasticity, weight gain, or reduced blood flow. But the actual length usually doesn't shrink dramatically unless there's an underlying health issue, such as Peyronie's disease or prostate surgery. And here's something many men are surprised to learn. Women and partners often care far less about size than men assume. In surveys, partners consistently value intimacy, connection, and communication far more than measurements. So while it's natural to be curious, size is rarely as important as confidence and care in relationships. If you're sitting there wondering, am I normal? Chances are, you are. The goal of this discussion isn't to make you worry more, but to relieve unnecessary stress. Every man is different, and there's no perfect number you have to hit. And finally, remember this. Penis size does not define your masculinity, your health, or your worth. What truly matters is understanding your body, taking care of it, and addressing concerns with confidence and clarity. In the next section, we'll walk through exactly how to measure length and girth correctly, using simple steps you can do at home. No gimmicks, just reliable methods you can trust. As men grow older, it's natural to notice changes in the body, and that includes the penis. Many seniors quietly wonder if these changes are normal or a sign of something serious. The good news is, most changes are a normal part of aging, and understanding them can help you stay confident and in control of your health. One of the most common concerns is that the penis appears smaller with age. While the actual length of the penis usually doesn't decrease dramatically, it may look shorter due to several factors. For example, over time, the body tends to store more fat in the lower abdomen. This added fat can create a buried appearance, making the penis look shorter than it really is, even if its size hasn't changed. In addition, the penis may hang differently in the flaccid state. As we age, the connective tissue loses some of its elasticity. This means the penis might not stretch or hang in the same way it did in your 30s or 40s. Think of it like a rubber band that's been used many times. It's still functional, but not quite as tight or springy. Another important factor is blood flow. Healthy erections rely on strong blood circulation. As men get older, especially those over 60, conditions like high blood pressure, diabetes, or cholesterol buildup can reduce blood flow to the penis. This can lead to erections that are less firm or shorter in appearance. This isn't necessarily a sign of a serious problem, but it is something to be aware of, and in many cases, manageable with lifestyle changes or medication. Hormonal changes also play a role. Testosterone levels tend to decline gradually with age, which can affect sexual function, energy levels, and even the way the penis responds to stimulation. Lower testosterone might not directly shrink the penis, but it can impact arousal and performance, which in turn affects how the penis behaves during intimacy. Some men also experience curvature or shortening due to a condition called Peyronie's disease, where scar tissue forms inside the penis. This can cause bending, pain, or even noticeable length loss over time. While this is less common, it's important to consult a urologist if you notice significant changes. The key takeaway here is that many of these changes are normal and part of the aging process. Just like graying hair or wrinkles, the penis also ages, but that doesn't mean your sexual health is over. Far from it. With good health habits, open conversations, and proper medical care, men can maintain a satisfying and confident sex life well into their 70s and beyond. Understanding these changes doesn't just help you feel better, it empowers you to take action, ask the right questions, and protect health. In the next section, will guide you step by step on how to accurately measure your penis length, so you have a clear picture of where you stand and what's truly normal for you. If you've ever wanted to measure your penis length accurately, you're not alone, and you're not being vain. Many men, especially in their later years, want to understand their bodies better, either out of curiosity for medical reasons or to track changes over time. The important thing is to do it the right way. Inaccurate measuring can lead to unnecessary worry or unrealistic expectations, so let's walk through it step by step, in a simple and respectful way. First, it's important to measure while the penis is fully erect. This gives you the most consistent and useful reading. A partial erection may give you a misleading measurement. Choose a comfortable, private setting where you feel relaxed. And avoid rushing the process. Use a firm, straight ruler or a measuring tape. Place the ruler along the top side of the penis, starting from the point where the penis meets the body, right at the pubic bone. Press gently into the fat pad until you feel the bone. This step is especially important for men who carry more weight in the lower belly, as fat can conceal part of the actual length. From there, measure all the way to the tip of the glans, which is the rounded end of the penis. Be sure the penis is straight and not curved downward or to the side during measurement, as that could slightly shorten the recorded length. Some men might find it easier to take 2 or 3 measurements and average them. This helps reduce any variation caused by angle, pressure, or positioning. Always measure standing up, as body posture can affect the results. It's worth noting that the flaccid, non-erect length isn't a reliable indicator of overall size. A man with a smaller flaccid penis may have a completely average or even above average erect length, so don't be alarmed if your flaccid size seems shorter. It changes due to temperature, stress, or even hydration. Another important tip: avoid comparing yourself to photos, media, or unrealistic expectations. Many images are edited, and self-reported measurements online are often exaggerated. Clinical studies provide a far more accurate and realistic reference. And remember, your size does not determine your value, ability, or masculinity. Measuring should be for your understanding, not judgment. This simple method can give you an accurate picture of your current penis length. Whether you're doing this out of curiosity, after surgery, or as part of a medical evaluation, it's a healthy step in knowing your body. Just like checking your blood pressure or weight, understanding your anatomy can bring clarity and peace of mind. In the next section, we'll show you how to properly measure girth or thickness, which is just as important when it comes to understanding what's normal for you and how it may change with time. Health conditions: measuring penis girth or thickness is just as important as measuring length when it comes to understanding your body. Many men, especially as they get older, become curious about how their body is changing and whether what they're experiencing is normal. Knowing how to measure girth properly can give you peace of mind and help you notice any changes that might need attention. Let's go through it step by step in a way that's simple, clear, and comfortable. To begin, it's best to measure girth when the penis is fully erect. This ensures consistency and accuracy. Girth refers to the circumference or the distance around the shaft of the penis. It's similar to measuring your waistline. You're checking how thick it is, not how long. You'll need a flexible measuring tape, like the kind used for sewing. If you don't have one, you can use a piece of string or soft ribbon and then measure that with a ruler. Just make sure whatever you use is not stretchy, so your measurement stays accurate. Wrap the measuring tape around the thickest part of the erect shaft, usually around the middle. Don't pull it tight, just snug enough so it's touching the skin without squeezing. Note the number where the tape overlaps, and that's your girth measurement. For most men, average erect girth falls between 4, 5 and 4, 9 inches about 11, 5 to 12, 5 cm. Some men like to take more than one measurement, at the base, middle, and just below the head of the penis to get a better sense of the overall shape. If you do this, simply average the 3 numbers, but for basic girth, the mid-shaft is a reliable and standard place to measure. If you're measuring in a flaccid, non-erect state, expect the number to be lower. Flaccid girth can vary widely throughout the day. due to temperature, stress, or blood flow, so it's not the best indicator of your average size. Keep in mind, girth, like length, can appear to change with age, as blood flow decreases due to natural aging or health conditions like diabetes or high blood pressure. Erections might not be as firm, and the penis may seem thinner. This doesn't necessarily mean something is wrong, but it's always good to keep track and speak to a urologist if you notice a sudden or significant change. Also, never compare your girth, or anyone else's, to what you see online or in media. Those images are often misleading or digitally enhanced. What matters most is that you know your own body and what's normal for you. Measuring girth isn't about judging yourself, it's about taking control of your health in a calm, informed way. Just like checking your weight or blood sugar, it's a tool that can help you stay aware, confident, and proactive. In the next section, we'll gently explore some of the most common myths about penis size and explain why many of them can be safely ignored, especially as we focus on health, not pressure. When it comes to penis size, many men, especially older adults, carry quiet worries shaped by years of myths, jokes, and misinformation. Let's take a moment to clear the air. Most of what people hear or assume about penis size simply isn't true. As a urologist, I want to reassure you with facts, not pressure, not judgment, just real, trustworthy information. One of the most common myths is that bigger is always better. In truth, studies show that size does not determine satisfaction for either partner. What matters far more is emotional connection, communication, and physical intimacy that's comfortable and enjoyable. Many partners even report that extremely large sizes can cause discomfort rather than pleasure. Another common belief is that penis size can be accurately guessed based on hands, feet, or nose size. This is completely false. There's no scientific evidence connecting penis size to shoe size, height, or any other body part. These ideas have been repeated for fun, but they're not medically true. A third myth that causes a lot of unnecessary anxiety is the belief that porn represents average or typical size. This is one of the most misleading influences. Most men in adult films are selected specifically because of above-average size, and those images are often exaggerated with camera angles or digital editing. Comparing yourself to that standard is like comparing your home kitchen to a restaurant on a movie set. It's simply not the same. Some men also believe that penis size stops growing late in life, or that it can suddenly shrink. In reality, penis growth usually stops around the end of puberty. As you age, the penis may appear smaller due to changes in skin elasticity, reduced testosterone, or weight gain in the lower abdomen, which can make part of the penis look hidden. But this isn't true shrinkage of the tissue. It's usually just a visual change. There's also the idea that you can increase your size with pills, pumps, or creams. Unfortunately, most of these products are not effective, and some may even be harmful. There is no medically approved pill or supplement that increases penis size safely. Surgical methods do exist, but they are complex, risky, and usually recommended only for very specific medical cases. Understanding the truth behind these myths can be incredibly freeing. You no longer need to carry the quiet burden of comparing yourself to false standards. For senior men especially, confidence and comfort come from knowing what's healthy, not chasing something unrealistic. Your health, your comfort, and your ability to enjoy intimacy should always come first. Penis size, as long as it's within the normal range and free of medical issues, is rarely a barrier to sexual satisfaction. If you ever have questions or concerns, speak with a trusted healthcare provider. That's where real answers come from. In the final part of this video, we'll explore when changes in penis size or appearance could actually be a sign of a health condition, and what to look out for as you age. Understanding your body becomes even more important as you age, and that includes being aware of any changes in your penis size, shape, or function. While most changes over time are completely normal and harmless, there are certain situations where a noticeable difference in size or appearance might point to an underlying health issue. Knowing what to look for can help you take action early and protect your overall well-being. One of the more noticeable concerns some men face is a sudden decrease in penis length or thickness. While gradual changes with age are common, a quick or significant reduction could be a sign of something more. For example, Peyronie's disease is a condition where scar tissue forms inside the penis, often after minor injury during sex. This can cause curvature, pain, or even shortening of the penis over time. If your erections become painful, curved, or feel harder in one area, it's a good idea to speak with a urologist. Another possible cause of shrinking or reduced function is low testosterone levels. As men grow older, testosterone naturally declines, but for some, it falls more than expected. This can lead to reduced libido, fatigue, mood changes, and changes in the size or firmness of the penis and testicles. If you're noticing these signs, a simple blood test can confirm your hormone levels, and treatment options are available. Erectile dysfunction (ED) is also a major factor that can affect both the appearance and function of the penis when blood flow is limited, often due to conditions like diabetes, high blood pressure, or heart disease. The penis may not get fully firm, making it appear shorter or less full. Treating the underlying condition can often improve not just your erections, but your overall health too. In some cases, obesity can make the penis appear smaller, even though its actual size hasn't changed. This is because excess fat in the lower abdomen can cover part of the shaft, making it look buried. Losing weight can help reveal more of your natural length and improve blood circulation, which benefits sexual health. Rarely, prostate surgery, such as after treatment for prostate cancer, and result in a shorter penis due to changes in nerve and tissue structure. While this change can be distressing, understanding it ahead of time and discussing rehabilitation options with your doctor can help minimize the impact. The key message is this: not every change is a cause for alarm, but sudden, painful, or extreme shifts in size, shape, or performance should be taken seriously. Your penis is part of your overall health, and changes can sometimes reflect what's going on in your heart, hormones, or blood vessels. If you ever feel unsure, the best next step is a simple, private conversation with a urologist. You're not alone, and your concerns are valid. Being informed and proactive can help you stay healthy, confident, and in control at every stage of life. Your health, confidence, and your peace of mind matter at every age. If this video helped you feel more informed or reassured, please give it a thumbs up and share it with a friend who might also be wondering in silence. And don't forget to subscribe. We're building a trusted space for senior men's health where no question is too personal. Take care of yourself,